Hello everyone. Today we're going to tackle about Joyce Travelbee. Joyce Travelbee was born on 1926 and died on 1973. On 1952, she became the psychiatric nursing instructor at DePaul Hospital Affiliate School in New Orleans. She then taught at Charity Hospital School of Nursing in Louisiana State University, New York University, and University of Mississippi. On 1956, she completed her Bachelor of Science in Nursing degree at Louisiana State University. She then completed her Master of Science degree in Nursing at Yale University on 1959. She then started to publish her articles, journals in nursing at the start of 1963. On 1966 to 1961, her publication of her first book entitled Interpersonal Aspect of Nursing began. In 1969, she published her second book, Intervention in Psychiatric Nursing, Process in the One-to-One Relationship. On 1970, she became the project director of graduate education at Louisiana State University School of Nursing until her untimely death. As a psychiatric nurse, educator, and writer, she started her doctoral program in Florida in 1973. Unfortunately, she was not able to finish it because she died later that year. She died at the prime age of 47 after a brief sickness. Human-to-human relationship model of nursing. The development of the theory was presented in her book Interpersonal Aspects of Nursing, which was published in 1961. The assumptions of the model are based on Soren Kierkegaard's philosophy of existentialism and Viktor Frankl's logotherapy. The existential theory believes that the humans are constantly faced choices and conflicts and is accountable to the choices we make in life. Logotherapy was proposed by Viktor Frankl, who is a survivor of Auschwitz, in his book named Man's Search for Meaning. It is a meaning-centered psychotherapy based on the assumption that meaning fulfillment in life is the best protection against emotional instability. Now, the main concepts of the nursing theory are suffering, meaning, nursing, hope, communications, self-therapy, and a targeted intellectual approach. Suffering is, as she quotes, an experience that varies in intensity, duration, and depth, a feeling of unease ranging from mild, transient mental, physical, or mental discomfort to extreme pain and extreme torture. Meaning is the reason as oneself attributes, while nursing is to help man to find meaning in the experience of illness and suffering. The nurse has a responsibility to help individuals and their family to find meaning. The nurse's spiritual and ethical choices and perceptions of illness and suffering is crucial to helping to find meaning. Hope is a faith that can and will be changed that would bring something better with it. Now, it is the nurse's job to maintain it and avoid hopelessness. Its core lies in a fundamental trust that the outside world and a belief that others will help someone when they need it. Now, there are 6 important factors and characteristics of hope. Firstly, it is strongly associated with dependence on other people. Secondly, it is future-oriented. Thirdly, linked to elections from several alternatives or escape routes out of its situation. Fourth, the desire to possess any object or condition to complete a task or have an experience. Fifth, confidence that others will be there for one when you need them. And sixth, the hoping person is in possession of courage to be able to acknowledge its shortcomings and fears and go forward towards its goal. Now moving on to the next concept, which is communications. It's actually quote, a strict necessity for nursing care. Next is using himself as therapy, or basically self-therapy. It is actually quote, one is able to use itself as therapy. Self-awareness and self-understanding, understanding of human behavior, the ability to predict one's own and others' behavior are important in this process. And lastly, targeted intellectual approach. A nurse must have a systematic intellectual approach to the patient's situation.
So now we are in Joyce Travelbee's nursing meta-paradigms. For Joyce Travelbee, the person is defined as a human being. Both the nurse and the patient are human beings. For her, health is both subjective and objective. Subjective meaning health is an individually defined state of well-being in accord with self-appraisal of physical, emotional, and spiritual status. Objective means that health is an absence of discernible disease. Absence as well of disability or defect as measured by physical examination, laboratory tests, and assessment by spiritual director or psychological counselor. The environment, meanwhile, is not clearly defined. However, she defines environment as the human conditions and life experiences encountered by all men as sufferings, hope, pain, and illness. Nursing, therefore, is an interpersonal process whereby professional nurse practitioner assists an individual, family, or community to prevent or cope with experience or illness and suffering, and if necessary, to find meaning in these experiences. Joyce Travelbee's human-to-human relationship model is a humanistic revolution, meaning it has interactional phases. The first interactional phase is the original encounter. The original encounter is the first impression by the nurse of the sick person and vice versa. It could be either stereotyped or traditional roles. The second interactional phase is emerging identities. This is the time when relationship begins, where the nurse and the patient perceives each other's uniqueness. The third is empathy, or the ability to share in the person's experience. Next would then be sympathy, when the nurse wants to lessen the cost of the patient's suffering. Sympathy goes beyond empathy. She says that when one sympathizes, one is involved but not incapacitated by the involvement. It is also the therapeutic use of self, meaning that the nurse uses themselves as a form of therapy for the patient. Next is rapport. Rapport is described as nursing interventions that lessens the patient's suffering. It is the relation as human being to human being, meaning the relationship between the nurse and the patient. She says that a nurse is able to establish rapport because she possesses the necessary knowledge and skills required to assist ill persons, and because she is able to perceive, respond to, and appreciate the uniqueness of the ill human being. The phases are in consecutive and developmental process, which is achieved by the nurse and the patient as their relationship progresses, meaning that all the interactional phases are done step by step, and the other cannot be completed without the completion of the previous one. So, logical form. Logical form is an inductive theory that uses specific nursing situations to create general ideas. So, it is specific to general. Next is the acceptance by the nursing community of Joyce Travelbee's theory. First is for the application. and the application of her theories in practice, meaning hospice or the self-actualizing life experience, assumption of the sick role, meaning of life and sickness and death, meaning that her theory can be used to determine the meaning of life and sickness and death by being ill. Next is for education. Her theory teaches nurses to understand the meaning of illness and suffering, so it's very connected to why the person gets sick. It can also be used for research. It can be applied for the caring of cancer patients. Next is for analysis. Joyce Travelbee's theory is not very consistent in clarity, meaning that the definition of terms came from dictionaries and books instead of her defining them by her experiences. She also uses different terms for the same definition, which confuses the readers. It also focuses more on adult individuals who are sick and the nurse's role in helping them to find meaning in their sickness and suffering, meaning that her theory is not very inclusive of healthy individuals. It is focused on the sick people. It also deals in families and their needs, but not in the community, meaning that it is very central to a small group of people in the society and not very inclusive of the entire community. It is also not very simple because it contains different variables. Meanwhile, in generality, it has a wide scope of application, but it is applicable only to those patients in distress and life-changing events, because Joyce Travelbee's theory focused more on human suffering instead of the human healthiness. For her empirical precision, there are low measures of empirical soundness. This is because of the result of lack of simplicity. It defines concepts theoretically but does not define them operationally, meaning that it is very theoretical and not very practical. The model itself has also not been tested. And this is because of the fact that it really focuses on sick individuals. For the derivable consequences, the development of quality of caring. It is useful because of its ability to describe, explain, predict, and control a phenomena. The phenomena would then be the person's sickness, or the person being sick. It also explains the variables that affect the establishment of a therapeutic relationship between nurses and patients, because again, it focuses on the patient being sick. So the therapy between the nurse and patient is very helpful because it would help the patient get better from their sickness. However, it has a lack of empirical precision, but it creates a lack of usefulness, meaning that just because it has a lack of meaning means that it's also not very useful because it's hard to understand and very not inclusive of other members of society. So this is Joyce Travelbee's most striking line. She says that a nurse does not only seek to alleviate physical pain or render physical care. Instead, she ministers to the whole person. The existence of the suffering, whether physical, mental, or spiritual, is the proper concern of the nurse. So it really says that Joyce Travelbee is really concerned with the suffering of the whole person and how the nurse can alleviate this suffering. And that is all for Joyce Travelbee's theory of human-to-human relationship model. Thank you for listening.